Atrial fibrillation is the most common arrhythmia worldwide, affecting 2% of the general population, and its prevalence is set to double by 2050. This heart rhythm disorder is characterized by fast, irregular atrial depolarization, and it increases the risk of thromboembolic stroke fivefold. This is as a result of blood pooling in the left atrium and systemic embolization traveling to the brain. So, anticoagulation is recommended for stroke prevention for intermediate risk and high risk patients. Apixaban, sold under the trade name Eliquis, is a novel or direct oral anticoagulant approved for the prevention of stroke and systemic embolism in patients with non-valvular atrial fibrillation. When blood begins to clot, the enzyme thrombin is formed, which releases fibrinogen, which is converted to fibrin, then binds blood cells called platelets together, resulting in a clot. Apixaban is a small molecule that reversibly inhibits free and clot-bound factor Xa, inhibiting thrombin, therefore preventing the risk of clot formation and stroke. Apixaban is rapidly absorbed, reaching peak plasma concentrations 1 to 3 hours after administration. It has 50 to 66% bioavailability, a 12-hour half-life requiring a twice-daily dose regimen, and a steady state is reached by day 3. Apixaban is metabolized by the CYP3A4 enzyme in the liver, and due to 25% renal excretion, annual monitoring of renal function is recommended. Prior to the introduction of direct oral anticoagulants like apixaban, vitamin K antagonists such as warfarin were widely used, but these have a slow onset of action, narrow therapeutic index, multiple drug interactions, and excessive bleeding, necessitating regular monitoring and dose adjustment. The need for a drug with a more rapid onset, more predictable pharmacokinetics, and limited monitoring was established as a need in clinical research. As a strong candidate for this role, apixaban's clinical trial results were extremely promising. A double-blind study back in 2011 reported a significant reduction in stroke and systemic embolism risk among 5,599 patients that were unsuitable for vitamin K antagonist treatment. More recently, a study also demonstrated a reduction in non-major bleeding occurrence with apixaban than with warfarin. Even more recently, a comprehensive systematic meta-analysis published in BMJ during late 2017 compared efficacy, safety, and cost-effectiveness of 5 different oral anticoagulants to warfarin in 23 different randomized trials involving a total number of 94,656 patients. In this massive review, the dose of apixaban, 5 mg twice daily, significantly displayed the most favorable safety and efficacy profile, and was still considered cost-effective compared to warfarin. The strength of these results are such that the National Heart Foundation of Australia, in partnership with the Cardiac Society of Australia and New Zealand, indicate that a non-vitamin K oral anticoagulant, namely apixaban, is preferred over warfarin in the treatment of non-contraindicated non-valvular atrial fibrillation in the 2018 Australian Clinical Guidelines for the Diagnosis and Management of Atrial Fibrillation. Conclusively, apixaban reduces the rate of stroke and systemic embolism without significantly raising the risk of bleeding in atrial fibrillation patients, and as such, apixaban has had an enormously positive clinical impact to healthcare. In terms of lifetime drug costs, apixaban therapy presents a slightly more expensive cost than warfarin. That said, research consistently projects that apixaban therapy leads to a longer life expectancy of around 0.5 years when compared to warfarin therapy. Moreover, apixaban presents a gain of anywhere from 0.28 to 0.40 quality-adjusted life years. Accounting for apixaban's superior safety and efficacy profile presents a reduction in hospitalization costs, and therefore a reduction in overall public health burden. Further data demonstrating the enormously positive clinical impact of the implementation of apixaban will become available in the ensuing years. No drug is without adverse effects. However, apixabans are still considered less severe than warfarins. Apixaban has a non-fatal bleeding risk of 18.9% in comparison to warfarin, which has 24% risk. Other adverse effects associated with apixaban include loss of balance, allergic reactions, headache, muscle pain and weakness, and joint pain. These remain relatively rare, and the clinical and social benefits of apixaban therapy strongly outweigh the low risk of adverse effects.